Hi, I'm Dr. Ron Goodlin, and welcome to the next edition of our video blog series with Kim. We're moving her teeth together with the orthodontics, and then we're going to finish off with some veneers for her. So why don't we go in and see how Kim is making it?
What really impressed me is that Dr. Goodlin was really true to his word. When he said that the orthodontics would be on for between 1 and 3 months, he really stuck to his words, because it's just short of 2 months and they're coming off. I underwent a very extensive home renovation where the contractors, they tell you 3 months, and 2 years later you move into your house without a kitchen. So I was a bit skeptical at the beginning. How could your teeth come together that quickly? But it happened, and I'm absolutely thrilled. And I'm thrilled that Dr. Goodlin stuck to his words, and he really knows what he's doing.
It's a red letter day because we've got the front teeth closed together, and then the next time I see Kim, we're going to be able to get started with restoring her front teeth.
Well, it's just exciting. Every day I look in the mirror to see the progress, and the gaps have closed, and we're ready to move forward to see the end product. I noticed within the past week in particular that the front teeth closed. The gap is pretty well closed, and the gaps on the side have opened, which I think is obviously a good sign.
That's right. It means that everything is evened up now, and that way when we restore the teeth, everything's going to be in proportion. It's not going to look as if you have two big fat front teeth. You're going to have teeth that all look normal.
This is exciting.
Well, this is fantastic. Okay, so what I'm going to do is take a wire and actually hook those two front teeth together so they have no chance of separating again.
Okay,
so
that's what I was concerned about, so I feel a bit relieved to hear that.
Right. So that way the teeth won't relapse in between now and the time that we start with the restorative work. So it'll probably be about a week, and then we'll get you in and we'll remove the braces, and we'll start with some bonding, and then when you come back after that, we can go ahead and start working on the veneers. Sound good?
Great.
Okay.
Thank you.
Okay, so the first thing we're going to do is we're going to remove the little power chain that we put on there, and again you'll see that over the course of the 1 week the power chain has really stretched out. So after about 2 or 3 days it really isn't doing a whole lot anymore, and you can actually see that in the camera. What we're going to do here is just place a little wire. That around. Good. Perfect. And so we can see that we've actually ligated the two front teeth together so that they're going to be solid in between, and there's no chance that that's going to reverse. So you can see what we've done is I've taken this wire and ligated, looped it around this band and this band, and made sure that it's nice and tight so these teeth cannot separate over the course of the next couple of weeks. And now we're just going to tuck this in underneath so it doesn't drive Kim crazy. All set to rock and roll.
I'm really excited. It's been less than 2 months. The braces are coming off next Thursday, and the bonds will be put on. So it's been very quick. It's been great. Everything has been exactly on time. You walk in and there's barely time to even sit down before you're in the dental chair. Free parking. I just go up the DVP. I never have to worry about downtown traffic. Previously I had gone to a dentist in downtown Toronto, which was a bit of a schlep. You have to deal with traffic and parking, and just straight up the DVP, free parking. Very punctual, many staff attending to me. I felt very pampered. I think that there's a lot of misinformation out there as to what can be done with cosmetic dentistry in your adult years. People, they don't really quite understand braces, and people think it's a 2.5-year process, and that sort of thing. So I think that there's just a lot of education and information that could take place. But I think if they'd like to improve and beautify their smile, I think it's a fabulous thing to do. And I think that when you're in your adult years, it's the time for you. We've invested so much in our kids, and I think that there's nothing wrong with with pampering oneself and feeling great about oneself, because when you look good, you feel great. Okay, guys, stay tuned, and I'll see you next week as we progress through my reinvention of Kim.